Let's go over vital signs. The first one is heart rate. This is the number of times the heart contracts each minute, the beats per minute. A normal heart rate is 60 to 100 beats per minute. An elevated heart rate is called tachycardia, and a lower heart rate is called bradycardia. Next is blood pressure. Blood pressure is the pressure applied on the walls of the arteries during ventricle systole and diastole. A normal blood pressure according to the CDC is 120 over 80, but this really varies depending on the patient. Everyone has their own normal. An elevated blood pressure is called hypertension, and a low blood pressure is called hypotension. Next, we have oxygen saturation, called SaO2. This is the percentage of hemoglobin that is bound to oxygen, which is measured with a pulse ox. A normal oxygen saturation is 95 to 100%. Low levels would indicate hypoxia. Next is the respiratory rate. This is the number of breaths taken per minute. Remember, when assessing, one inhale and one exhale equals one breath. A normal respiratory rate is 16 to 20 breaths per minute. A high respiratory rate or rapid breathing is called hyperventilation, where a low respiratory rate or depressed breathing is called hypoventilation. Next is temperature. This is the body's ability to regulate heat. A normal temperature is 97.8 degrees Fahrenheit to 99 degrees Fahrenheit. But this value really depends on how you take the temperature, such as orally, rectally, axillary, or temporally. An increased body temperature is called hyperthermia or a fever, and a decreased body temperature is called hypothermia. Last but not least is pain. Yes, pain is a vital sign, and it's subjective data given to you by the patient. It's most commonly taken by a rating scale from 0 to 10. If you are a new nursing student and you need help with the basics like this, you can find it in the Complete Nursing School bundle. Happy studying, future nurses.